This is not just another health warning, it's a critical alert that could change your understanding of what's lurking in your medicine cabinet. What if the very pills you take for common ailments, your allergies, that nagging insomnia, persistent anxiety, feelings of depression, or even an overactive bladder are silently, insidiously, and dramatically accelerating your risk of dementia? This isn't a far-fetched nightmare, it's a shocking reality backed by extensive research. Imagine this: taking just one of these seemingly harmless everyday medications daily for a mere 12 months could skyrocket your dementia risk by a staggering 50%. We're talking about substances that don't just make you feel a bit groggy. They're linked to actual brain shrinkage and measurable memory loss, according to strong evidence from multiple large studies. These aren't exotic experimental drugs. They are common prescriptions and over-the-counter remedies that are likely sitting in your home right now. If you or someone you love uses any of these medications, you need to keep reading to understand what they are, how they quietly damage your brain, and most importantly, the safer alternatives you can choose instead. Don't let yourself or your family members unknowingly contribute to cognitive decline and accelerate the onset of dementia. The culprits we need to be extremely cautious about belong to a class of medications called anticholinergics. While that sounds like a complicated medical term, it simply means these drugs block a vital brain chemical known as acetylcholine. Think of acetylcholine as your brain's very own spark plug. It's a crucial neurotransmitter that helps neurons, your brain cells, communicate with each other. This communication is absolutely essential for everything from remembering where you put your keys to paying attention during a conversation, and even for the smooth movement of your muscles. When you take these anticholinergic drugs, especially for extended periods, it's akin to throwing a giant wrench into your brain's intricate communication system. The crucial brain signals become weaker and weaker over time, leading directly to the memory loss and cognitive decline that are hallmarks of dementia. You might be surprised just how many common medications fall into this problematic category. For instance, many of your standard allergy medications, like Benadryl, diphenhydramine, are potent anticholinergics. They're also found in numerous over-the-counter sleep aids, such as Tylenol PM or Unisom, which often contain similar antihistamines. Certain anxiety medications, like hydroxyzine, also known as Vistaril or Atarax, are also part of this class. If you use medication for bladder control such as ditropan, oxybutynin, or Detrol, tolterodine, you're likely taking an anticholinergic. Even some common IBS medications like Bentyl, dicyclomine, and motion sickness patches like the scopolamine patch are included. It's vital to understand that whether these medications are available by prescription or over the counter, they all exert the same brain-blocking effect, hindering that crucial acetylcholine activity. The evidence linking these medications to brain damage is robust and growing. One comprehensive systematic review and meta-analysis, which examined data from over 1.5 million people, unequivocally demonstrated that the use of anticholinergic drugs is an independent risk factor for all types of dementia, including Alzheimer's disease. This extensive study also found a clear dose-response relationship. The heavier your exposure to anticholinergic drugs, the higher your risk of developing dementia. Another deeply concerning meta-analysis, compiling results from 21 separate studies, revealed that anticholinergic use for more than 3 months increased the average risk of dementia by an estimated 46% compared to non-users. Just 3 months of consistent use could dramatically elevate your risk. Furthermore, a groundbreaking study published in JAMA Neurology used advanced brain imaging to show that long-term use of anticholinergic medications was associated with increased brain atrophy, meaning your brain actually shrinks in size, and brain dysfunction. This goes far beyond simply feeling groggy. These drugs are physically altering the structure and function of your brain, directly impacting its metabolism and long-term health. Once you grasp what's truly happening at a cellular level, the profound harm these medications can cause with long-term use becomes starkly clear. To understand why these medications are so damaging, let's delve a little deeper into their mechanism. In your brain, acetylcholine needs to bind to specific sites on your neurons called muscarinic receptors. This binding process is what facilitates smooth communication between brain cells, enabling all your cognitive functions. These muscarinic receptors are also crucial players in your parasympathetic nervous system and are found throughout your body, not just in your brain, but also in your heart, lungs, and digestive system. This widespread presence explains why anticholinergic drugs are used to alleviate symptoms like nausea, gut spasms, or an overactive bladder. They block acetylcholine's action in these areas to calm symptoms. However, when these drugs cross into the brain, they create a severe blockade of communication, particularly in critical areas like the hippocampus and cerebral cortex. These regions are absolutely essential for memory formation, learning, and overall cognitive function. This is precisely why anticholinergic drugs pose such a significant problem. In the short term, they can cause temporary side effects like brain fog, confusion, and slower reaction times. But with prolonged, consistent use, this constant disruption can lead to permanent brain damage and observable brain shrinkage. This effect is especially pronounced and concerning in the elderly, as our natural levels of acetylcholine already tend to decline as we age. If you're taking a medication that further reduces this already diminishing spark plug activity, you are, in essence, rapidly speeding up that natural decline, cutting off one of the brain's main lines of communication. The longer this goes on, the more profound and irreversible the damage becomes. Given this alarming information, how should you approach your current medications? It's important to clarify that this isn't a blanket statement that these drugs should never be used. Taking a single Benadryl for an isolated night of severe insomnia, while not ideal, is likely fine for most people. Similarly, anticholinergic drugs might be necessary for severe allergic reactions or in specific short-term situations for urinary incontinence or irritable bowel syndrome. The critical takeaway is this: what we absolutely must avoid is taking these medications daily for months, or even worse, for years on end. This long-term chronic use is where the significant risk to brain health emerges. This warning is particularly crucial for individuals who are at a higher risk, such as those over 60 years old, people who already experience mild memory issues, or especially those who are taking more than one anticholinergic drug simultaneously. The latter scenario, unfortunately, is remarkably common and frequently observed in medical practice. A person might be using hydroxyzine for anxiety, then adding Benadryl or Unisom for sleep, and also taking Ditropan for bladder control. While each drug individually blocks a bit of acetylcholine, when combined, their cumulative effect can be akin to shutting down major vital parts of the brain and central nervous system. So, here's your actionable plan to protect your brain health. First, take immediate action by going through your entire medicine cabinet. This means checking both your prescription medications and all your over-the-counter pills. Use online resources like anticholinergic burden scales, or even better, consult your doctor or pharmacist to determine if any of your medications are anticholinergic. Second, and this is crucial, do not stop any of your medications or make any changes to your regimen without first discussing it thoroughly with your doctor. Your physician can help you safely taper off or switch medications. Ask your doctor if you can be switched to safer, non-anticholinergic alternatives, especially if it's a medication you need to be on long term. For example, if you're taking an anticholinergic for sleep, non-anticholinergic alternatives could include melatonin, ashwagandha, chamomile, or specific forms of magnesium. Ensure you're using the right kind for sleep. There's a separate video on that if you need guidance. For prescription options, trazodone has minimal to no anticholinergic effects and is often effective for sleep. If you suffer from allergies and are currently using Benadryl, you should strongly consider switching to second-generation antihistamines like Zyrtec, cetirizine, Claritin, loratadine, or Allegra, fexofenadine. While these are still technically antihistamines, they have significantly less penetration into the central nervous system and brain, making them far less likely to cause damaging anticholinergic effects. For those managing bladder control with medications like oxybutynin, Ditropan, tolterodine, Ditrol, or solifenacin, Vesicare, ask your doctor about a non-anticholinergic option such as Myrbetriq. If you have IBS and are prescribed a drug like dicyclomine, Bentyl, discuss alternatives like peppermint oil with your doctor. There are also other prescription medications that can be chosen based on whether your IBS is constipation predominant or diarrhea predominant. Finally, if you have been on these drugs for a long time, there's no need to panic, but you can immediately start optimizing your brain health. Prioritize getting regular, restorative sleep and engaging in consistent physical exercise. Additionally, focus on identifying and reversing other known risk factors for cognitive decline and dementia, such as insulin resistance, high blood pressure, and heart disease. I'm actively working on a comprehensive series about optimizing overall brain health, so stay tuned for future videos where I'll delve deeper into those crucial strategies. This information is powerful, and taking control of your medication choices is a vital step towards safeguarding your cognitive future.